Now, thalassemia is a very rare condition. That's why I chose this, because it is very interesting and there are some points which I want to mention here. Because they have got very weak bones and it can give a lot of challenge. Secondly, there is a lot of infection which is involved in such cases. I come from Kokilaben Ambani Hospital from city of Mumbai. Thalassemia is an inherent blood disorder with mutation of alpha and beta hemoglobin genes. Now, there are two types where thalassemia major is a major problem for all of us because these patients usually need frequent blood transfusions and chelation therapy. Now, what it does is because of frequent blood transfusion, they are more prone to infections and also there is a problem of bone. So here, if you see, there is a skeletal dysmorphism, and this is a classical thalassemia child with a skull X-ray on the lateral side. Now, coming to the long bones, which really interest us, they have got marrow expansion and they have got thin cortices. So these guys are more prone to fracture. After saying that, I am going to my case where he is a 31-year-old thalassemia major. He was operated by myself 4 years ago with supracondylar fracture femur, which I plated with a locking plate. Now, he had multiple infections in the past. In our hospital, he was admitted 3 times with IV antibiotics, with chest infections, buttock infection, etc. So he presented to me for almost 3 months of hip pain and now getting worse and inability to bear weight. So as I told in my discussion before, the obvious cause was infection. So his hip was aspirated and not to our surprise, it grew pseudomonas. So he was very aggressively treated by my arthroscopy colleague with arthroscopic hip debridement and washout. This was followed by IV antibiotics and oral antibiotics for 3 months. And fortunately, the infection completely settled down. This remained for 1.5 years when he again presented to me with severe pain and limp. This time, the inflammatory markers were completely normal, and I aspirated his hip, which was negative. So this is how the picture looks like. Now you can see a classical honeycomb-like appearance, and on the left side, the hip is completely arthritic, which is post-septic, and I was very reluctant of offering him a total hip replacement. And that's because if you see the lateral X-ray, this is a shadow which still I was not very sure whether there is a lurking infection. And I mentioned to him clearly that, look, I'm not sure whether the hip is aspirated still. I think there is some sort of infection. But he insisted that I should do a hip replacement simply because he flatly refused the options of arthrodesis and excision arthroplasty. So very reluctantly, with high risk consent of infection, I went ahead and did this. And this was the quality of head on table. And this is how the post-op X-ray looks like. Now, a lot of you must be wondering, in a 31-year-old, why I went for a hybrid hip. And that's because we had a previous discussion. There is no limit why we are using this, because the cup was pretty stable. This is a trabecular metal cup, which was quite stable with 3 screws and 10-degree liner. While I was brushing the femur, what I found is the bone is extremely poor, and the broach was just not having any stability. There was 0 rotational stability. And so I had to use a cemented stem. And this turned out to be a blessing in disguise, because if you can note, the plate which I put in, I could put the cement right up to the first screw so that there were no stress riser. If you see on the lateral X-ray as well, I could avoid a stress riser, because knowing the bone quality, if I would have put a stem, which is even a slightly shorter stem, this would have put a serious stress riser. So the point I want to make it, what the panel discussed before, is age is not a criteria. He was clearly door 3 with very poor bone. So I had no hesitation of putting a stem in him. And remember not to have a stress riser, because if you are having a nail or a plate, and if you keep a small bone which is a porotic, I mean, a lot of time they can fracture it. He presented to me a couple of months ago with a bad knee. This time, he had got a stress fracture on the medial side with completely denuded bone. So, and a very poor quality. So I put a semi-constrained knee with a cement here. And I told him that, look, I'm going to present your case. So this is how he is just 3 months ago, happily dancing in a Sangeet party. This is 9 years post hip replacement and 1.5 year post total knee replacement. He's a very enthusiastic child, as you can see. Thank you very much.